Welcome to Elevate Pod, where we elevate your mindset, we inspire your spirit, and ignite your leadership journey. This podcast is brought to you by Elevate Leadership Services. My name is Pearl.
And I'm Chibochungu.
We are the co-founders of Elevate Leadership Services.
Okay.
We focus on minorities and immigrants and offer valuable tools, resources, and pathways to foster personal and professional development.
Thank you. Thank you to our audience. And most importantly, to Sherlene Mullinax, who is with us today to share her tremendous experience as well as her journey in home healthcare, housing needs, and community businesses. As we explore a vital aspect of our society, home healthcare, we are going to focus on housing needs and the role of community businesses. Every community has a story. Let's dive into how housing and health intersects to create vibrant, thriving neighborhoods. Just imagine a world where every individual, regardless of age, condition, has access to safe, supportive housing that meets their unique needs. According to the World Health Organization, a solid foundation in community-built environments can significantly enhance the quality of life, independence, and health outcomes of seniors and individuals with disabilities. Today we'll discuss how community businesses can bridge the gap in home healthcare, creating thriving environments for everybody. Before I ask Sherlene to add on to our bio, I'll briefly give you the bio that she shared with us. Sherlene is a California native with a remarkable journey of service. Sherlene built a calling into a successful enterprise. Her path was profoundly shaped by many faith and experiences from both parents following their dementia diagnosis, teaching her that everyone needs to feel valued and understood. This led her to create the Serendipity-SM, a room and board business for adults with intellectual disabilities. The enterprise flourished and later morphed into Serendipity-SM Room and Board Placements, LLC. As the owner of the agency, she acted as a vital intermediary, facilitating matches and earning revenue through referral fees from partner facilities that provide positive living environments for seniors, veterans, and individuals with special care needs. She's a dedicated placement advocate for adult protective services, various agencies and hospitals throughout the California region. With a robust professional background, including retirement from AT&T Communication as a project management professional in 2026. She is now a mentor, and she does that with individuals, helping them to understand their intricacies of the care industry. She holds a degree in engineering, a BA in behavioral health, and she's a certified contract consultant and licensed RCFE, which is Residential Care Facility for the Elderly Administrator. She is currently pursuing a master's in divinity degree at Epic College. Outside her professional life, she finds peace in worshiping God, spending time with her 2 children and family, community service, and enjoying hobbies such as book clubs, golfing, playing chess and fishing. We should go and play golf together. So, Sherlene, do you have anything to say?
Elevate Pod, I just want to thank you for that warm introduction. It's a pleasure to be here on this platform with you two amazing women to tackle the subject matter that's not just important to minority immigrants, but also to the whole diaspora of women involved. And this is a conversation that is something so dear to my heart, and that is home health care for our seniors, home health care for our veterans, and home health care for those who are less unfortunate. And so I want to get into this conversation with you today and have fun. Thank you so much again for the invite.
Yeah,
And
thank
thank
you.
you. And thank you, everyone, for tuning in. In this episode, as we have heard, we're diving deep into the intersection of home, healthcare, and community business. As the population ages, the demand for tailored housing solutions is more critical than ever. But what does that look like? It's about more than just roofs overheads. It's about ensuring that our communities are inclusive, accessible, and responsive to the needs of every resident. We will share stories of innovative community businesses that are inspiring, transforming, and encouraging changes in the home healthcare landscape. Together, let's explore what it means to care for our communities. So let's dive in.
Right.
My first question to you is, what does home mean to you in the context of health and well-being?
Well, to me, home isn't just a physical address. It's a primary foundation for a person's dignity. I see home as the first prescription for health. If you don't have a stable, safe environment, as you know, a safe place to rest your head, no amount of prescriptions can help you. No amount of therapy can fully heal you. So we've moved past the walls of saying that home is just four walls. It has to be more to us than that at at an age of 65 and above. We are active partners in wellness. This is what home means to me. It's the difference between a senior living in fear of being alone, having
Mm.
to navigate steep staircases and dark hallways in a home, and a senior who can move freely is what we're trying to move towards. We want our seniors to be able to move freely in these spaces, spaces of universal design, like zero steps and levers, handles, for the arthritic hands as they're trying to turn knobs to go in and out of rooms and homes in the house. So it may sound cliche, but I feel home is our personal sanctuary. We've heard that over and over again. Home is a personal sanctuary. And if it feels like that to us, we want that to feel like that for our seniors and our veterans and our disabled.
I love that.
Beautiful.
I love that. I tell people my home is my sanctuary, and
Yeah,
I'll make it the way it is so that when I come home, I don't have to want to run out. And I'm happy to hear that as you deal with the health needs, you consider home as a sanctuary for them as well. And what I loved hearing is when I heard that before you even go to taking any remedy, medication, anything, if you don't have a home,
yes,
then you anything else that we're adding to the people or give anybody else may not go further.
absolutely.
So
Absolutely.
wonderful, wonderful. So my follow up question, maybe another question that I have for you is the primary housing challenges that the seniors face today. What are those? What do you see as you work and interact with them?
Yeah. That's an excellent question. Statistics show in 2025, they did a critical analysis in 2025. There was a what we call a critical supply and demand imbalance,
Mhm.
which means basically there's more elderly than ever before. Why this is because we have our baby boomers. As you know, they're turning at the age of 80. So that's the generation that was born between 1946 and 1964. So with that new construction for seniors, housing has slowed in the past year due to high financing costs, as you know, as well as labor shortages. The national occupancy rates for um, expected this year to surpass 90% in just 1 year, making it difficult for many to find available housing. We have factors like we call the missing middle affordability gap, which means a lot of times, approximately, I'll say a lot of times, most of the seniors can't afford private senior housing because it's often required high out of pocket payments.
Correct.
Rent growth has stabilized at more than 4% annually, which puts immense pressure on those with fixed incomes. You have Social Security benefits, voucher housing, but those are now limited this year. We are in a different climate nationally. And so it has impacted our seniors and our veterans tremendously. And I just want to add, for if there's some young viewers that are on the line with us, when I was so excited to retire. Okay. And I said, oh, at 55, I can do this. And at 60, I can collect this. And Social Security at this time and different things like that. We are now in a new climate. That was then and this is now. The official full retirement age in the US for to claim Social Security is 67 years old. And most are born, and this is for people that are born 1960 or later. So now you have individuals that were born prior to 1960. Yes, they can claim Social Security at 66, but it's limited.
Correct.
So you can claim Social Security at 62, but your payments are going to be limited. And so for the senior who solely worked for Social Security benefits, thinking that that was going to uh, keep them and sustain them, it's now being a problem. It's now a challenge for our seniors.
So it's not
Um,
sufficient.
exactly, exactly. So I say this briefly to say to our young listeners, if we have any young listeners out there, diversify your portfolio. And what that means is if you are going to retire, don't just rely on Social Security. It's not going to look the same as it looked for maybe your mother or your grandmother. You're going to need to learn how to invest in annuities and 401ks, know what stock options are. And I just wanted to briefly touch on that because this is something very passionate to me when I'm trying to house individuals and their sole income is Social Security. And a lot of times it's not enough.
Yeah.
It's not
I,
enough.
I think everybody, if we all check our social security, I think, and we are all encouraged to register online, so
Right.
that we can see how much we are getting on a yearly basis.
Yes.
Many of us with mortgages, and I'm telling you, there are so many that will never finish their mortgage. That
Uh-huh.
can only go to pay not even your mortgage, not even everything else. So
Right.
it aren't
Right.
enough. It aren't enough.
Absolutely. Yeah. So, physical, I just wanted to touch on that just briefly
Mhm.
because I think it's important for us especially on these platforms that
Yes.
we have outlets for people to go to and be able to get informed about these things.
Mhm.
But moving forward, physical inaccessibility.
Mhm.
Okay. Um, 4% of US homes currently offer basic accessibility features such as no step entries,
Mhm.
wide hallways, single floor living. But most seniors live in older homes, what
Correct.
we call our Peter Pan homes. Okay. They require expensive modifications to prevent falls and different things like that, and mobility aids. So, increased health, we're still talking about some of the concerns and challenges that we face. Increased health complexities. Um, a large number of our adults, age 65 and older, manage at least one chronic illness. 80% manage at least two.
Mhm.
And so, or more. The this necessitates a high level of home support, in-home support, and caregivers to come into the homes. Self service enriched housing is currently in short supply. Okay, room and boards are in short supply because of these demands. People are just not going or not being able to stay in place in their own homes because of the fact that they are not accessible medically for their needs. Um, if they do stay in their homes, a lot of times social isolation takes place, loneliness.
Mhm.
Many seniors that live in areas lacking neighborhood services and transportation alternatives. A lot of them uh, have issues coming in and out of their home, and it leads to isolation. Could you imagine staying in your home
Oh,
all day, just looking at four walls? This not only affects the physical health, it affects the
mental,
psychological health,
mental.
Right, right.
and it gets worse without community-based intervention. So,
Correct.
thus
Oh,
you have agencies like Adult Protective Services, our room and board placements come into play, Veterans Association, uh, several agencies, hospital agencies, and social workers come into play, and they are definitely needed. So,
yeah.
hopefully, we can work as a collective to manage a lot of these issues that our seniors are having today.
I think one person cannot resolve. I think it will take communities, it will take a lot of businesses, it will take the government, I think, to address the needs that you're talking about.
Yes, absolutely.
Right. It sounds like lots of collaboration is needed to really make this a success. And you did touch on something I would like to piggyback on to get on to our next question, which is in the area of awareness. How can we raise awareness about the importance of home health care in our communities and also awareness in the area of preparation? What can we do now? What can people be aware of now to prepare for that future?
Great question. So, uh, raising awareness about home health care requires a mix of direct community engagements, strategic local partnerships. We're in a digital world now. And that's the awesomeness about this. So we can target digital storytelling and normalize it as a service and highlight its benefits. Face to face interaction is a good and most effective way to build trust and education in the community. We have educational workshops. We can host what we call lunch and learn or seminars in our local communities, our civic centers, or our churches, um, anything. We can host it right here. We have platforms like
Right.
Elevate Pod. We have Facebook to give how to do guides to tailor the needs for our seniors and our veterans. Speaker series, having these conversations, bringing local groups together with geriatric professionals, CNAs, nurses. There are, and this is just a few things that we can do as far as drawing attention and giving awareness to this senior citizen and I call them senior citizens. They like to be called seniors only, seniors and veterans and some of our disenfranchised. So we have so many tools in 2026 to raise awareness, and I'm really excited about it.
Yeah. We all have to know how to use them. And
Absolutely, yes, we do. Absolutely.
so I think maybe I can just a little bit follow up on that. So you work with the people who are seniors, and some are not exposed to all these technological tools that we have. So how are you navigating to make sure that they are utilizing them, and especially that you are using them to bring the awareness question that Pearl raised?
So, are we referring to bringing awareness to our seniors,
Yes,
or?
even to our
Okay.
seniors and development.
So seniors normally, if you sit down and have a conversation with them, they can tell you exactly what their needs are. They can tell you what's lacking at their age as far as having accessibility in their home, um, financial issues, things of that nature. And so, what we've tried to do with the social workers is come together and create a template so that we can talk to our seniors and our veterans about co-living model programs, which makes affordable housing complexes that are structured for seniors. Um, like I was talking about before, homes that have wide hallways and accessible entries and lighting. We have technology that's out that we introduce them to that is senior friendly,
Okay.
where they can actually turn on their thermostat with ease.
Okay.
Um, how can they can actually turn on the um, I want to say the security system. That is a big issue for seniors. It's not just a physical issue; it's a psychological issue at a certain age. They have to feel safe.
All right. Perfect. All right. And now I can move to my next question after that.
Did I over?
Yeah. My next question is more on innovations and
Okay.
innovative solutions that I imagine in home healthcare housing. What are they, and how are these fitting the needs of the community that you are serving?
Awesome question. Modern housing is being equipped with systems, as I kind of touched on lightly, that learn a resident's routine to detect health challenges before a crisis occurs. Um, you have AI smart home integration systems that can be put in place. I think I mentioned co-living model programs such as SASH is called Support and Service um, at Home,
Okay.
useful and affordable housing tools for the new age house, and that is going to make it easier for your seniors and your veterans, especially veterans that maybe have ambulatory problems, seniors that have ambulatory problems, to get in and out and have more accessibility to things that are normally now difficult for them. Virtual reality therapy, VR, is now being used for an at home physical rehabilitation, glamifying balance exercises to provide cognitive stimulation. Things of that nature is new age, and and for the senior it seems like it's a lot, but once we integrate that into their homes and into their living spaces and show them, hey, at a click of a button you can turn your thermostat up and down, things like that, they pretty much enjoy it after that,
Yeah.
because it's
Perfect.
new and it's something easy that they can handle, and it still gives them a level of independence.
Independence. Yeah. Wonderful. Thank you.
Now, we talked earlier about collaboration and partnerships. In
Mhm.
this question, I'd like to know, what role do local governments play in supporting community health initiatives?
Local government, as you know, acts as a primary driver of community health by managing environments where people live, bridging gaps between clinical medical care and social factors that determine elderly longevity um, and their long term success. Government often um, funds the last resort services. They manage the clinics and the social services and the support for our elderly when their insurance runs out, or as we talked about, Social Security. Some of them have limited Social Security. So these agencies kind of pull together to help bridge the gap. And government supported agencies are also feeling the impact. I just wanted to say that they're also feeling the impact of our large amount of elderly residents that we're starting to have. And so they have done their best on a state level to kind of see if we can feed more income, more money into these agencies. Meals on Wheels programs, those are for seniors for their nutrition. Local food pantries. So a lot of our seniors are faced with sometimes, can I pay my rent? If I pay my
Mhm.
rent, will I have money for food?
Food.
So government agencies play a big part in helping us substitute some of their needs.
And I think you point out something that is actually, to me, you feel that for many of us in this country,
Mhm.
that's the choice that we shouldn't have.
I
Where
know.
you're saying, if I do this, will I have this? Especially for a lot of people that have worked so tirelessly,
Hmm.
only towards the end, you can't even afford to buy food, or you can't afford to have even a tiny home that allows you to have the dignity.
Yeah.
That's it's really very sad, because those are some of the things probably in different parts of the world that probably they don't happen because of communities that they have, families that they have. But here, where I can't just go and squat on my in my son's house, it's not.
Right.
I
Right.
think we need to have a system that if I have worked, many people have worked, they didn't just work 8 hours, they work maybe 16 hours. At least at the end of it, the least we should have is accommodation that is affordable,
Yes.
and accommodation that will allow them to put at least 3 meals on the table.
Yes, exactly. And I just real quickly, I had the pleasure of going to visit um, Ghana in
Hmm.
December. And so
Okay.
I was curious. I said, let me walk around here and see what home health care looks like. Do you realize that I could not find maybe one or two facilities for the elderly?
Mhm.
Because traditionally,
Yes.
um, their communities are 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 standing on traditions where we took care of our elderly. We took care of mom when she couldn't take care of herself and got to a certain age. We brought grandmother in the house, or we went and lived with grandmother. And
Hmm.
so family dynamic I noticed was really
Yes.
strong there. And
Yeah.
so we have to kind of get back to that
Yeah.
here in the United States. My parents are, I mean, when we talk about minority immigrants, we're all immigrants here in
Of
the United
course.
States,
Of course.
if we want to say that. And so I say that to say my parents are from the South,
Okay.
um, Southern states, Texas, Mississippi, things of that nature. And our traditions were pretty much the same.
Correct.
When you're elderly, when seniors, when your parents become seniors, and you take care of them, you take care of them, and that was based spiritually because they had a strong spiritual connection, and they believed that that was tied to our spiritual beliefs, and
Correct.
so um, I see now that more and more of African Americans and minority immigrants are in the system, And so I sometimes I question, where is that coming from?
Correct.
So it's not just a US and a United States thing. It's a cultural thing altogether. And we have to kind of get back to our roots and take care of our elderly, take care of
Correct.
our seniors, take care of our veterans.
Correct. And the richness of a community is having a community that can take care of each other.
Yes.
We understand financial limitations, maybe the ones that are leading to what we are seeing,
Mm-hmm.
but we can find it within ourselves to say, how can we support
Mm-hmm.
our aging parents,
Yeah.
even our children, and I think it can be in different forms.
Mhm.
So it's my hope that as we get older ourselves, we won't be seeing what sometimes we are seeing, because that is what really worries me. Yeah. So
Great. Well, fear not.
yeah.
You have agencies like myself
Yes. Yes.
who, and you have several different people in the community that see the need,
Yeah.
and we say, hey, if the family can't, um, for whatever reason, and sometimes it's just too much for the family,
It is. It can be.
agencies that we can come in and bridge that gap.
Yeah.
And with the help of government, we have been making strides with our seniors and our elderly and our veterans to give them quality homes and care. So,
Right. And before you come in, Chua, maybe let me just ask this, because you said something that kind of ties into it. You did talk about partnerships. So earlier we talked about local governments, but there's also businesses within our local communities. And so I'm curious there, in your experiences, what kind of partnerships, apart from the government, what kind of partnerships between businesses and yourselves as providers, what partnerships have been most effective?
our partnerships that have been most effective are the ones with our hospitals, um, partnerships with nonprofit agencies as well as nonprofit hospitals. We can invest, they can invest for our housing health care. They can come out and help our seniors with screenings. So I have a lot of, um, well, I won't say a lot, I have some seniors that need additional care. They're independent living seniors, but Sutter Health comes out. Sutter Pace program comes out to help them administer their medication, to check their blood pressure, any type of needs of physical. Hey, I maybe can't get in the shower like I used to. We have the county in-home support service that can come out to the homes and help them transition back and forth to the showers and restrooms and things like that. Once again, Adult Protective Services plays a very pivotal role in Sacramento, California. With these particular agencies and these particular I wanted to piggyback on something, but I'll keep going. But APS does a quite a bit, a lot for the community of seniors.
Okay.
Wonderful.
All right. Okay. One of the questions that I have is the barriers that I think we have barriers in a lot of places, and the healthcare homes is, I'm sure, has its own. So, what are the most significant barriers that you see to seniors and other people accessing home care, healthcare services?
Accessing home healthcare services, accessing home healthcare services involves navigating complex web and systematic and personal obstacles. You have workforce shortages. The primary constraint is a critical lack of qualified healthcare professionals, including nurses and home health aides. High turnover, burnout, often drives is driven by volatile scheduling and low wages. So with issues as far as that goes, frequent waiting list, and a lot of seniors are put on hold because of these issues where we can't refer them out as soon as
Mhm.
they need. There is a waiting list. Financial and insurance constraints. While Medi-Cal, well, they call it in California Medi-Cal, but while Medicare, Medi-Cal cover many services, insufficient insurance coverage for long-term or personal care. Often, these types of care they can't afford, and so Medi-Cal reimbursement cuts this year, last year, is affected a lot of our seniors, and so families are having to pitch in to try to pay out of pocket costs for their seniors, and it's just been a domino effect between staffing to
Mm.
medical coverage. um, these are a lot of the barriers that we're starting to see in this industry. Geographic and physical barriers. um, you have patients in rural areas that need care, but they live in what we call healthcare deserts, where travel times are prohibited. They don't have um, the infrastructure set up where that they have means to travel, have means to make it to their appointments, and different things of that nature. Public transit is not always available in these areas for them. I want to
Mm.
mention one more thing, before, if I may, before we go on. Social and cultural disparities. And we're talking about immigrants. So we have immigrants that are, and we just talked about it before, we used to not see very many immigrants coming through the system. But
Mhm.
now, like I said, with different climates that we're in nationally, we have a lot of immigrants that are coming through the system, but they're having issues as well. Their barriers are language barriers, certain stigmas that they've been labeled with, depending on the culture, and bias for marginalized groups. That's playing a big factor. Can lead to mistrust. A lot of them are frustrated. A lot of immigrants are frustrated because they need the same amount of care as any other senior, but for different things dealing with language and different things like that, they're not receiving the same level of care.
We are almost running out of time. This topic is very relevant, and I think it's also relevant to even us who are here talking about it. But unfortunately, we'll be running out of time. But we have maybe two questions before we wrap it up, because we really
Okay.
need to get some answers from these two questions. Although we have some other ones, but
We could go
unfortunately,
on
because
for
of time.
another hour. So
Yes.
I'm excited about this. I just want everybody to understand where we're at right now.
No, wonderful
Right,
answers,
And I
because you,
right.
thank you for
yeah,
this awesome platform again, because with this platform, we can go out to many platforms just by this conversation we're having now. So
correct, correct,
Right,
correct.
right.
Yeah.
Well, we could keep going on, and in the interest of time, I'll still, ask one question. Squeeze in two into one. Maybe how about that?
okay.
All right. So talking about, you just said something about infrastructure, and also earlier you said something about culture. So I'd like to know the role of cultural differences. How does culture impact housing preferences and needs? And talking about impacting needs, also, just if you could touch also on, I know you look at adults with intellectual disabilities, so let's just talk about accessibility.
Okay.
Accessibility for people with disabilities, and also cultural differences. How does that impact?
Okay. So, as we said, there were some barriers
Hmm.
in regards to cultural differences. Now, impacting housing and preference needs, in home health care, understanding cultural housing preferences is vital because Physical environment, as we discussed, determines how effectively um, clinicians can deliver care. Cultural differences um, impact everything from room layout to who lives under one roof, multi-generational living. Many cultures, including Hispanics, Asians, some Middle Easterns, their communities come from multi-generational households. That's more than two people.
Mm-hmm.
For a home health provider, this means navigating a larger care team
Mm.
um, of family members, but it also leads to overcrowding concerns. And those are things that's the norm for some cultures. But when we come in, or when some of our professional medical people come in, we're saying this is kind of an overcrowded area. We have to create accessible walkways, but when we have, like I said, generational people living in one home, it can be difficult. um,
Mm.
Designed for ritual and tradition. I say that because housing preferences often include specific spaces for
Mm-hmm.
prayer rooms, specific kitchen layouts. Like I said, we're talking about different cultures now and what the things that are important to them. So, prayer rooms, specific kitchen layouts to accommodate traditional food preparation areas. In healthcare, and I think you pretty much know this, sacred or traditional spaces. A lot of times, some of our healthcare professionals don't realize how important that is to certain cultures. That is
Mm-hmm.
very important. That's tied to their physical health care, their spiritual, their psychological health care. A lot of times we have to be more sensitive to certain things like that. So when we're bringing in the oxygen tanks and the hospital beds and different things like that, we have to keep in context that these people have certain areas where they pray in the morning. These people have certain areas where they worship, and so we can't just start moving things around in those particular.
Mm-hmm.
But I can go on and on about that. But those are some of the things that I saw and I've observed.
So you have to make sure that when you're going in a home, you understand the cultural aspect of it, rather
Absolutely.
than just going in and sometimes the good that you want to do can negate uh, the results because you
Right.
are not addressing the cultural
Right.
aspects. So
Right. And
it's
and we have to we have to build trust.
yes,
And that's part of
yes,
building trust,
yes,
respecting people's culture, respecting people's
yeah,
traditions and their religions, uh,
yes,
being able to give a level of empathy to those things.
correct,
Uh,
correct, correct, yeah.
because we really want to try to help, but sometimes it's difficult if we're not sensitive to those things.
Yeah. And you know what? We can only do good if we can understand first before we start acting.
Yes, I like that. I like that. Yes.
All right. I think we have come to our final question for today. I wish we had ample time, but Shalene, I think this discussion need to be heard by so many. And I think there's more for us to discuss in future. And we see that we'll call you again for sure to have
Oh,
you on this platform because there's so much that you can talk about that we haven't even gone into
yeah.
to bring to bring forth for our audience. However, I would like to ask you this question in terms of the message that you'd like to share with our audience who may be experiencing similar challenges at home or the home healthcare needs services that they need. What would you like to part with?
My parting message would be, and it's simple: you are doing the hardest job there is, and you don't have to do it perfectly to be doing it right. There are systems and there are people whose entire purpose is to help you carry the load. So if there's anyone out there that is struggling with trying to manage a certain age group, I encourage you to reach out for help. Don't suffer in silence. A lot
Mm.
of people are suffering in silence because they they're ashamed of saying, I can't remember certain things like I used to, different things like that. There are memory care issues. Reach out before you hit a breaking point. Reach out to your local services, adult protective services again, advocates for veterans, Department of Human Services, local hospitals. You have a community that is here to help.
Wonderful. Thank you so much, Sherlene. We truly appreciate you for bringing this information to our audience. And there's one thing that you touched on in the beginning is about investments, and I think that will come in at a later time because it's very
Absolutely.
important the way you tied these two things and the impact it's going to have on every one of us who are going to be retiring very soon. And I think we need to know this information, and our audience need to have this information.
Yes.
uh, I'm going to go to the closing so that we unfortunately are running out of time. I wish we had more time, but thank you, Shalene, for
Thank you.
accepting.
Thank you for having me.
Yeah, we truly appreciate you accepting and joining us today to share this information that is very critical to immigrants and minorities. I think the more we are informed, the better we can continue to prepare ourselves. As we explored the synergy between housing needs and community businesses in home health care, it also became clear that collaboration is key between different agencies. And I think this is going on, and I hope it can be elevated even further. Each one of us, I think, we play a role in the well being of our neighbors. So let's also become advocates for accessible housing, which should
Yes.
be driven by compassion and also by innovation. Let's all remember that change begins with you and I. Let us all continue to engage and inspire our communities to create environments that where everyone is not going to just thrive but will also be able to live. As we part today, let's consider how that your unique role can continue to make in home healthcare and make homes healthier for all. Whatever
Yes.
steps you can take, please continue to do so that you can contribute to this discussion that is so critical to each and everyone's livelihood.
Awesome. Before I bring it to a close, if you would please, for the sake of our audience, if you could just share some information about your business. Where can someone find you? Where can someone find your place and turn it into their home?
Oh, absolutely. I am Serendipity-SM Room and Board Placements. You can find my link on Facebook. You can find my link on Indeed. You can find my link also if you just click on serendipitysm.com. It'll take you right to my business page. And with that, we have things set up in place where we can answer questions for you if you have any housing or placement needs or anything dealing with financial needs. There is a window on the website that can help you with that. I'm also listed on Skip Grants as we move into getting grants for various things through our agency. I have a website on skip.com as well.
It's wonderful.
Wonderful, wonderful. Thank you so much for sharing that information. As we wrap up today's discussion, let's take forward the essential insights we have heard today, shared about home health care and the importance of community driven solutions. So, whether by supporting local businesses or advocating for policy changes, every action counts. Let's be the voice for those whose needs often go unheard. Together, we can build a healthier,
Yeah.
more inclusive future
Yes.
because every individual deserves the dignity of a safe and supportive home. Thank you again, Sherlene, and thank you everyone for listening. We hope to see you in the next episode. Thank you for joining us on this journey to elevate and inspire. Until next time, lead with purpose and grow with passion. Thank you.
Thank you so much. Bye.